Hi, everybody. For this week's clinical conference, we have AD, who is a 15-year-old female with a past medical history of malnutrition, induced bradycardia, and hypotension, as well as a psychiatric history of anorexia nervosa restrictive type. And she was admitted to U of M on 11/15 for the eating disorder protocol and close monitoring during the refeeding process. When checking in with the patient and her mother, she says that the meals have been going well. She's able to take in 100% of her meals and snacks, and she has not required any supplementation. This morning, she did experience some signs of indigestion, which she described as chest pain and a headache. The doctor was aware, and they're aware of that. Her vital signs have been stable over the past 24 hours, with her heart rate ranging between 55 and 80, and she had no episodes of hypotension requiring intervention. She's continuing to gain weight, and she's gained 1.9 kilograms since admission. Her current weight is 39.3 kilograms. Yesterday, she said she had an emotional day because her sister is having some emotional difficulties at home. The patient's currently rating her anxiety as a 5 out of 10. Her mother and the patient completed um, the child anxiety related disorders as screen, as well as Beck's depression inventory, which were both positive for anxiety disorder as well as mild mood disorder. And we discussed the results with the patient and her mother. Um, the patient says that, and the mother, they were not surprised at the results, and they felt that psychotropic medications may be beneficial for her. She says that she's experiencing some anxiety with meals and also with the transition of being discharged from the hospital. So, with the education that we performed with the patient and her mother, they were both very receptive, and they understood what we were trying to educate them on regarding the side effects and also the recommended medications, as well as therapy being a part of her treatment plan once she is discharged. So, the plan for her is we are looking to get the patient some outpatient psychiatric services specific to eating disorder kids, and she's currently on the wait list for U of M's eating disorder clinic. At this time, we are going to start Zoloft 12.5 milligrams daily for her, and we're doing it at a lower dose to prevent side effects. And she's also going to have PRN Zyprexa 2.5 milligrams 30 minutes before meals, and we're doing that as a short-term relief for the anxiety that she's having before meals. And they were both educated on the potential side effects and the dangers that Zyprexa may cause, but those side effects are dose dependent. So she is at a much lower risk of those side effects given that the dose is very, very, very low. Her mental status is her appearance: she's an adolescent female laying in bed, dressed in a hospital gown. Her general behavior: she's calm and attentive, showed no signs of abnormal movements. Her attitude towards the examiner was cooperative. Her state of consciousness is alert. Attention was intact. She was able to give me a digit recall accurately. Her orientation was A&O times 4. Her psychomotor activities showed no abnormal movements. Her mood was good. Her affect was congruent with her mood. Her speech was rate was regular, volume was soft, and articulation was clear. Her form of thought had no signs of circumstantial thoughts or flight of ideas. Her thought content: she had no signs of preoccupations or obsessions. Judgment was good. She knows that she needs help and is open to trying medications as well. Her insight was also good because she knows that she is ill and she would like assistance with her illness. For her diagnosis, Axis 1 is anorexia restrictive type, Axis 2 is deferred, Axis 3 malnutrition and bradycardia, hypotension as well. Axis 4 is school and anxiety related stress, and their global assessment function is 80. I found an article that talks about antidepressant treatment in an adolescent population, and it says that particularly SSRI reuptake inhibitors are the first line pharmacological intervention for pediatric patients with anxiety disorder, obsessive compulsive disorder, and major depressive disorder. And this is why we started her on the SSRI serotonin. So let me know if you have any questions. Thank you.